Hi everyone, my name is Stefan, I'm a pulmonologist. In this video I'd like to discuss about a very important topic. It's a question I get asked a lot, and that is that some patients do develop hoarseness in their voice following the use of inhalers, such as this one, or it could be not a puffer, it could be something like this, or like this little one here, or some other inhaler entirely. And often enough, I think it's down to a question of two things. The first thing that I'd like to discuss with you and to maybe consider in your case is whether you are definitely using it correctly. So some of these inhalers, especially like this one, for example, so inhalers that have like this sort of a canister that you put in a little cover and then you press and then they release a spray. These ones, you basically need to synchronize your breathing in of the medication with really a deep, slow breath. Now, if you don't do this correctly, you may end up with a lot of medication deposited at the back of your throat. And that can sometimes lead to hoarseness in your voice because the medication is really acting at the back of your throat rather than your lungs. So it's really important with all the inhalers to have proper technique. Generally, it comes down to two types of technique that you need to use. So for example, for inhalers that are like this one, which is a puffer, so it generates a little puff, you may have seen it on the camera. These inhalers have a specific way of being taken. So it's a slow and deep breath. So with inhalers such as this one, you basically want to empty your lungs first completely. And then as you're starting to breathe in, you trigger the inhaler and you continue to slowly and deeply breathe in. Hold your breath at the top for up to 10 seconds and slowly release. So I'm going to show you how to do this now. There are some other videos on this channel, obviously, that maybe go into details for specific types of inhalers, but for inhalers such as this one, so an MDI inhaler, metered dose inhaler that generates a puff, this is how you use it. So I'm just going to demonstrate now. So I'm just going to empty my lungs. Hold, and release. I'm going to do that one more time so that and then I'll explain a little bit what I'm doing so that it's clear. So I'm just going to empty my lungs first. And slowly release. So what I've done there basically is as I started to breathe in with empty lungs, so you empty your lungs of air, and from the bottom, basically, as you're starting to breathe in, you just press on the inhaler and you start to slowly and deeply breathe in. Keep breathing slow and deep until you reach the top. Hold your breath at the top and then slowly release. There is another type of inhaler, which is a dry powder inhaler. So these are things like Symbicort, for example. Let's use this one. So the one I used before was a Foster inhaler. I'm just going to demonstrate on a Symbicort inhaler. But generally, if you've got a device that contains a powder, and you can probably hear the shaking inside. Some of them don't produce this sound, so don't worry. With these ones, basically, once you arm them, and there are various techniques to do that, depending on the device. There are some videos on my channel, again, as I mentioned, on specific devices if you're interested. But basically, for example, for the Symbicort, you hold the device, and then you turn clockwise, counterclockwise, and it makes a click. So that means that it's armed. And at this stage, basically, I want to empty my lungs. And because it's a powder inside, I need to breathe in forcefully. So remember, for this one, I breathed in slow and deep. For this one, I'm going to breathe in powerfully and deeply. So I really want to get that powder moving, to get it deep inside my lungs. It's a heavier powder. It doesn't produce a puff that I just breathe in slowly, right? So for this one, I'm just going to demonstrate now. So it's armed, it's ready to go. So I'm just going to breathe it in. And slowly release. So at the top, try to hold your breath a bit longer than I did. For the sake of this video, I'm not going to hold it for the full 10 seconds, but if you can, try to do that. So I'm going to demonstrate again. I need to arm the device again. And then I'll explain things as I go. So it went click again. I hope you heard that click. So now it's ready to go. I know that it's ready to go. So I'm breathing in, emptying my lungs, and then I really pull in that powder, really. So breathe in forcefully and deeply. So let's do that now. Emptying my lungs. and slowly release, right? So what I've done there basically is to empty my lungs and breathe in forcefully to get that powder moving. Compare this to the technique I use for this one, where I breathe in a bit slower and deeper, as if I'm trying to catch that puff as it's going in. But like you see in this demonstration, there are different ways of taking each inhaler. And then some of these devices might have different ways of working. So for example, for this one, I would twist it, arm it, and then take it. So again, it might be a heavier powder inside. It might be different compared to this one, or other devices. So it's really important to familiarize yourself with the device that you are using, because if you're not using it correctly, most often the medication will reach the back of your throat, because that's what everyone does when they breathe in a little powder. It just deposits itself here, but it won't really go in deep into the lungs where you need it, basically to treat your respiratory condition. And what happens when the powder is deposited at the back of the throat? Obviously, there's a little bit of irritation, and that sometimes causes voice hoarseness. A second thing to consider, which is really important, is that voice hoarseness is sometimes related to the use, or maybe overuse sometimes, of steroid-containing inhalers. Now, most inhalers, actually, unless it's a reliever inhaler, do contain a little bit of a corticosteroid, which is an anti-inflammatory drug. Now, the anti-inflammatory drug, the corticosteroid, is very useful to control the inflammation in the lungs, but you don't really want that medication to be at the back of your throat. So some patients sometimes develop, even with very good technique, a little bit of voice hoarseness because of the steroid contained in their inhalers. And that is something that we anticipate. Now, one way to get around that, if you're using perfect technique, but your inhaler does contain a steroid. So for example, a Symbicort inhaler will contain steroids. A Foster inhaler will also contain steroids. Seretide as well will contain a corticosteroid. Now, one way to get around that, if your technique is perfect, is to try to remember, after you finish taking your dose, to take a little glass of water, swish some water around your mouth, gargle, and spit, because that will eliminate most of the powder that's around here that's got stuck at the back of your throat. Even if you have a perfect technique, there might still be a little bit lingering at the back of your throat, which may cause irritation in your voice. So taking a little bit of water, swishing it around, gargling, and spitting it out after you've taken the dose can go a long way into preventing voice hoarseness. I hope you found this information helpful. Do check out my other videos. There are some videos on inhaler technique on this channel, and I plan to post more and more videos about simple medical tips related to respiratory conditions. I'll see you in future videos. All the best.